Is your yellow, thick nail just ugly or something worse? I see it in my office every single day. Patients come in embarrassed about their toenails, trying to hide them under closed shoes, avoiding sandals, skipping beach trips. They tell me, "Doctor, it's just cosmetic, right? It's not really hurting anything." Wrong. That thick, yellow, crumbly toenail isn't just an appearance issue, it's an active infection. And if you're ignoring it, hoping it will go away on its own, I have news for you. It's getting worse every single day. My name is Dr. Andrew Schneider, and I'm a podiatrist here in Houston, Texas. In my 25 years of practice, I've seen what's happened when people ignore toenail fungus. I've seen minor infections spread to multiple nails. I've seen diabetic patients develop serious complications, and I've seen countless people suffer needlessly because they didn't understand what they were really dealing with. Today, we're going to talk about why your toenail fungus keeps coming back, and more importantly, how to stop it for good. This is the second module in our Toenail Health 101 series, and by the end of this module, you'll understand exactly what you're fighting and how to win. But first, if you're serious about getting rid of your toenail fungus once and for all, hit that subscribe button and ring in that notification bell. I post new videos every week with proven strategies for foot health, and you don't want to miss them. Also follow me on social media. The links are in the description. I've written a comprehensive book about toenail health that includes detailed treatment protocols for fungal infections. You can get it absolutely free at www.mytoenailbook.com. The link is right there in the description below. Let's start with the truth about what toenail fungus really is, because most people have no idea what they're actually fighting. Onychomycosis, that's the medical term for toenail fungus, isn't just one type of organism. It's actually 3 different types of fungi that can infect your toenails: dermatophytes, yeasts, and molds. Dermatophytes are the most common culprits. They're the same organisms that cause athlete's foot, and they absolutely love the environment inside your shoes: warm, dark, and moist. They feed on keratin, which is the protein that makes up your toenails. Yeasts, particularly Candida, can also infect toenails, especially in people with compromised immune systems or diabetes. Molds are less common, but can be particularly stubborn to treat. Here's what makes the toenail fungus so insidious. These organisms are designed to survive. They've evolved over millions of years to thrive in exactly the environment your toenail provides. So they're not going anywhere without a fight. Who's most at risk? Understanding your risk factors is crucial because it determines both your treatment approach and your preventative strategy. Diabetics are at the highest risk. High blood sugar creates an environment that fungi love. Plus, diabetes affects circulation and immune function, making it harder for your body to fight off infections. Elderly patients are also a high risk. As we age, our circulation decreases, our immune system weakens, and our nails grow more slowly, giving fungus more time to establish itself. Athletes, especially runners, swimmers, and anyone who spends time in locker rooms, are constantly exposed to fungal organisms in warm, moist environments. People who frequent shared spaces like public pools, gym showers, nail salons with poor sanitation practices, or even shared family bathrooms are at increased risk. But here's something that might surprise you. Poor circulation is often the underlying factor that allows fungus to take hold in the first place. When blood flow to your toes is compromised, your immune system can't effectively fight off infections. Let's talk about how to recognize toenail fungus early, because the sooner you catch it, the easier it is to treat. Early signs include yellow, brown, or white discoloration that starts at the tip or the edge of the nail, slight thickening of the nail, a chalky, powdery substance under the nail, a musty odor coming from the nail, and advanced symptoms include significant thickening that makes the nail difficult to cut, brittle, crumbling texture where pieces of the nail break off, a complete separation of the nail from the nail bed, and it can spread to multiple nails. Here's the critical point. If you're seeing these symptoms, you've had the infection for months, possibly years. Fungal infections don't happen overnight. They develop slowly and progressively get worse. Now let's address the elephant in the room. Why over-the-counter treatments usually fail. Walk down the foot care aisle of any pharmacy and you'll see dozens of products claiming to cure toenail fungus. The truth is, most of them have success rates of less than 10%. Here's why they don't work. First, penetration problems. Your toenail acts like a shield, protecting the fungus underneath. Most over-the-counter topical treatments are water-soluble, which means they wash away when your foot sweats. They simply can't penetrate thick infected nails effectively. Second, inadequate concentration. Even if the medication does penetrate the nail, the concentration that reaches the infection is often too low to kill the fungus. Third, people make critical mistakes on how they apply the product. They apply them inconsistently. They stop treatment too early when they see initial improvement, or they don't address the underlying factors that cause the infection in the first place. Filing or scraping the nail, another common mistake, can actually make the infection worse by creating microscopic injuries that allow the fungus to spread deeper. Let's talk about treatment options that actually work. In my practice, I use a comprehensive approach that addresses both the infection and the underlying factors that allow it to develop. Topical treatments can be effective, but you need the right product used correctly. Toenail is one of the most effective topical treatments I recommend. Unlike the over-the-counter products, Toenail is specifically formulated to penetrate the nail and maintain therapeutic levels of antifungal medication. Toenail works best for an early-stage infection or as maintenance therapy after other treatments. It's also excellent for people who can't take oral medications due to other health conditions. The key with any topical treatment is consistency. You must apply it at least 6 to 9 months, and you must continue treatment until the entire infected nail has grown out and it's been replaced by healthy nail. Oral antifungal medication represents the gold standard for treating toenail fungus. These medications work from the inside out, reaching the infection through the bloodstream rather than trying to penetrate through the nail. Terbinafine, also known as Lamisil, is generally taken for 12 weeks for toenail infections. It has a success rate of 70 to 80% for complete clearing of the infection. The medication concentrates in your nail tissue and continues working even after you stop taking it. Itraconazole or Sporanox can be taken daily or in pulse doses. Pulse dosing involves taking the medication for 1 week per month for 3 months. This approach can be easier on your system while still providing effective treatment. Now let's address the concerns about side effects. The main concern with oral antifungals is potential liver toxicity, which is why blood tests are required before starting treatment. However, serious liver problems occur in less than 1% of patients taking these medications. In my experience, the benefits far outweigh the risk for most patients. The psychological and physical benefits of clearing a fungal infection are enormous, and the actual risk of a serious side effect is low. Nail debridement is a crucial part of effective treatment that most people don't understand. Thinning and trimming of the infected nail to remove as much fungal material as possible. Think of it this way. If you have a thick infected nail that's 3 to 4 times its normal thickness, any topical medicine has to penetrate through all that infected material to reach the nail bed where the infection is growing. By removing the bulk of the infected nail, we dramatically improve the penetration of topical treatments. I perform nail debridement in the office using specialized instruments. It's painless and immediately improves the appearance of the nail while making other treatments more effective. Let me tell you about KeriFlex, a cosmetic solution that can drastically improve your quality of life while your infection is being treated. KeriFlex is a cosmetic nail restoration system that creates a flexible, natural-looking nail over your damaged toenail. It's made from keratin resin, the same material your natural nail is made from, which makes it flexible and porous. Here's what makes KeriFlex so special. It's safe to use over fungal infections, unlike acrylic nails, which can trap moisture and make infections worse. KeriFlex is porous and allows the nail to breathe. You can continue your antifungal treatments while wearing KeriFlex. This means you don't have to hide your feet for 9 to 12 months while you're waiting for a healthy nail to grow out. You can wear sandals, go to the beach, and feel confident about your feet while the infection clears. Let's talk about realistic timelines for seeing results, because this is where most people get frustrated and give up. Remember, toenails grow slowly, only about 1 millimeter per month. It takes 9 to 12 months for a great toenail to completely grow out, and 6 months for smaller toenails. Here's the timeline you can expect. Months 1 through 3, the infection stops progressing. You may not see visible improvement yet, but the fungus is being killed. Months 3 to 6, you start to see a healthy nail growing from the base. That's when some people get excited and sometimes make the mistake of stopping treatment. Months 6 to 12, the healthy nail continues to grow out, gradually pushing out and replacing the infected nail. The key is consistency. You must continue treatment until the entire infected nail has been replaced by a healthy nail. Stopping treatment early is the #1 reason why fungal infections come back. Here's a phrase I use with my patients. It gets better before it looks better. The infection may be clearing even when the nail still looks terrible. Trust the process and stick with your treatment. Why do infections come back? Usually it's because people stop treatment too early. They don't address the underlying risk factors, and they reinfect themselves from contaminated shoes or environments. Let's talk about preventing reinfection, because clearing the infection is only half the battle. Shoe care is crucial. Fungus can live in your shoes for months. Use antifungal shoe sprays daily, rotate your shoes to allow complete drying between wears, and consider replacing old contaminated footwear. Environmental precautions: always wear protective footwear in public areas like pools, gyms, and locker rooms. These environments are breeding grounds for fungal infections. Address underlying health issues. If you have diabetes or circulation problems or immune system issues, work with your doctor to optimize your overall health. Poor circulation and high blood sugar creates environments where fungus thrives. Maintain good foot hygiene. Keep your feet clean and dry, change your socks daily, and use antifungal powder in your shoes. Here's something most people don't realize. Not all thick, discolored nails are caused by fungus. Conditions like psoriasis, trauma, or bacterial infections can cause similar symptoms and require completely different treatment. This is why proper diagnosis is essential. In my office, I often take a sample of the affected nail and send it to the lab for testing. This confirms the presence of fungus and identifies the specific type, which helps guide treatment selection. Treating a condition that isn't actually fungus explains why many treatments fail. You can't cure a bacterial infection without antifungal medication, and you can't cure trauma-related nail changes with any medication. Let me share a success story that illustrates why comprehensive treatment works. I had a patient, let's call her Maria, who had struggled with toenail fungus for over 10 years. She had tried every over-the-counter treatment available, spent hundreds of dollars, and was ready to give up. When Maria came to my office, we started proper diagnosis. Lab testing confirmed that she had a dermatophyte infection. We began with nail debridement to remove the bulk of her infected material and started her on an oral terbinafine and applied Keriflex for cosmetic improvement. Within 3 months, the infection had stopped progressing. Within 6 months, healthy nail was clearly growing at the base, and within 12 months, she had a completely healthy nail for the first time in over a decade. The key was comprehensive treatment that addressed the infection from multiple angles, plus patient education about prevention to avoid reinfection. What about laser therapy? I get asked this question frequently, and I'll be honest with you. I had a laser in my office for treating toenail fungus, and I returned it because I wasn't satisfied with the results. Laser therapy works by heating the nail and underlying tissue to temperatures that kill fungus. While some practitioners report good results, in my experience, the success rates weren't consistent enough to justify the cost to patients, especially since insurance does not cover it. The treatments that I've outlined today, oral medications, effective topicals like Toenail, nail debridement, and comprehensive care, have proven track records and much better success rates. Let me give you action steps you can take right now. First, get a proper diagnosis. Don't assume that a thick, discolored nail is fungus. See a podiatrist for evaluation and testing. Second, if you do have a fungus, commit to comprehensive treatment. Half measures don't work with fungal infections. Third, address your risk factors. Improve your foot hygiene. Replace old shoes. Manage underlying health conditions. Fourth, be patient and consistent. Fungal infections didn't develop overnight, and they won't clear overnight. Fifth, don't suffer in silence. There are effective treatments available, and there's no reason to hide your feet or avoid activities you enjoy. Toenail fungus is frustrating, embarrassing, and potentially dangerous. but it's also completely treatable when you use the right approach. If you found this information helpful, please hit the like button and share this video with anyone who's struggling with toenail fungus. Your share can help someone finally get the treatment they need. Subscribe to the channel and follow me on social media for more evidence-based foot health content. The links are in the description. Don't forget to get your free copy of my toenail health book at www.mytoenailbook.com. It includes detailed treatment protocols and prevention strategies for fungal infections. If you're dealing with toenail fungus that hasn't responded to over-the-counter treatments, don't wait any longer. Schedule an appointment for proper diagnosis and treatment planning. We can evaluate your specific situation and develop a treatment plan that gives you the best chance of finally eliminating your toenail fungus for good. The link to schedule is in the description below. Remember that thick yellow nail isn't just ugly, it's an infection, and it's getting worse every day. But with the right treatment approach, you can have healthy, clear nails again. Thanks so much for watching, and have a great day.